Welcome to our Focus Live here again from St. Mary's Hospital. I'm Dr. Hussein Kremali, Chief Medical Officer here at St. Mary's Hospital. Each month we highlight special services and providers that are opening them up new avenues and services that are going to be available here in the Waterbury market and through St. Mary's Hospital. Today, I'm extremely delighted to have Dr. Kathleen Mueller, who is here. She is the physician leader for integrative medicine at Trinity Health in New England. Thank you very much for joining us today.
So happy to be here.
In the short time that we're together, I'd like to talk a little bit about your specialty, integrative medicine, what that is, and what it means to the patients in Greater Waterbury. But to begin with, I want to talk a little bit about your journey to get to integrative medicine. You practiced and got your medical degree in family medicine, but then started looking at furthering that through a different avenue. Tell us a little bit more about that.
Yeah, I did. So board certified in family medicine, did private practice for a long time. And what I found was frustrating is that I just didn't have all the tools that I needed, particularly when we were coming into connection with patients with pain. And so 26 years ago now, I started studying medical hypnosis.
Okay.
And brought that into my practice.
Wow.
And then about 10 years later, a friend of mine was like, we should do acupuncture. And I'm like, no, we shouldn't. And I did. I studied acupuncture. The first course that I took was with Dr. Lee in San Francisco. And then I did the Harvard course in Japanese acupuncture about 10 years ago.
Great.
No, more than that, 15 years ago.
Okay.
And so then brought that into my practice. And then St. Francis was looking for somebody to help bring their integrative medicine program forward. And I agreed to be the medical director, but also felt like I needed additional training. And so I did a 2-year fellowship with Dr. Andrew Weil at the University of Arizona, specifically in integrative medicine.
Okay.
And what that helped me bring in is connect the acupuncture, connect the medical hypnosis, but also bring in expertise in food, in movement, and supplements, which kind of, I think, rounds out that education so that we can bring it to patients.
Yeah, and so we're talking about not only, your knowledge base is not simply just Western medicine, but you're now able to tie that together in your knowledge of the clinical and the pathophysiology, sort of as we've described it, but also marry that with the integrative medicine, the world of nutrition, the world of supplements, but also the ideas of and the worlds of acupuncture and massage therapy.
Yeah.
Fascinating.
It's so important. I think all or none just doesn't work, right? Western medicine doesn't have all the answers.
Correct.
Neither does, so complementary means, oh, by the way, let's throw this in. Sometimes food is the most important tool.
Yeah.
And alternative means, let's not do this, let's only do that. And I just think we need to, integrative is literally integrating the two worlds and using the best of those worlds.
Yeah. And when we talk about food and nutrition and supplementation and these alternative methods of coping with disease, even today, I think a lot of Western medicine would point to lifestyle stresses and food as being a significant contributor to how patients feel on a day-to-day basis.
Yeah, it's huge. And we have 30 years of experience showing that prescribing a diet doesn't work. We have to work bigger. We have to work with behavioral interventions. We have to work with stress reduction so that people can actually do what they already, most of them know what to do.
Yeah.
Eat real food, mostly plants, not too much. But it's simple, but it's not easy to do in our culture.
Yeah. And so when we talk about that, it being simple but not easy to do, what are the barriers to the buy-ins, first from the patients, but also from clinicians?
So I think with patients, most people know what acupuncture sort of is. Yeah. Most people aren't, some people are afraid of it, most aren't. It's becoming a little more common. It's, I think, the fact that sometimes simple changes can have profound effects. We can't quite compute, using Western medical brains, how in 6 acupuncture visits, back pain can go away. Like it doesn't add up.
Right.
When we use a Western medical brain. Well, we can't use a Western medical brain.
Right.
So I think there's some hesitation that sometimes a simple approach can be effective. And I think the second one is how do they figure out who to trust? And I think that's from the provider side as well. How do you figure out who's a good acupuncturist? What comes into the education of a massage therapist? And so that's where I am able to bridge the two worlds and kind of bring those two worlds together.
Yeah. So you're able to, so tell us a little bit about the process. what services, we talked about acupuncture, massage, maybe we can talk first about just what services, and you had mentioned St. Francis, which is our sister hospital up in Hartford, but yet we've opened up a center right here in Waterbury.
Yes.
Tell us about that.
So I am so excited because I started my career at St. Francis, and then after COVID, I was asked to launch a regional program, which is what I've wanted to do forever.
Great.
And so we did some market research, and we found that this area in Waterbury, in the greater Waterbury area, just doesn't have these services. That is so fun that we can bring this down to patients who are eagerly looking for it. We are now right over the border of Waterbury, like 150 yards into Prospect. We have a beautiful space. And in that space, we have acupuncture, energy work, and massage therapy, and physician consultation. If somebody knows they want acupuncture, they can call, they can make an acupuncture visit. There's no barrier. You don't have to do a consultation to be able to access our services, which I think is really important. Some people know exactly what they want.
Yeah.
Some people don't. And so if, say, you're coming in with migraine headaches, there is a part of nutritional changes that we can make, supplements that we can add, and I use massage and acupuncture often for that kind of pain syndrome. And I can sit with a person, and if they say, massage is not my thing, or I'm not doing that acupuncture thing, whatever, we can individualize the program for them and kind of do it stepwise and see what happens.
So what are the other services so you talked about energy therapy.
Yes.
Could you expand on that a little bit?
So energy therapy is an interesting one. The whole idea is that we have an energy field. We can measure it. EKGs measure it. EEGs measure it. We have energy fields. And we know that we can measure it anywhere between 3 and 6 feet out from our bodies. And the idea, the Eastern medicine idea that backs up acupuncture is that if you have pain or dysfunction, energy is stuck. And we need to move that somehow. Sometimes it's with food, sometimes it's with movement, sometimes it's with acupuncture, sometimes it's with massage. Energy therapy is one human being using their energy field to move other people's energy field. There is less rigorous science in huge studies behind energy therapies, but what we know is that for many people it reduces stress. It is incredibly relaxing, and for many, it relieves pain. And so we have a craniosacral therapist who is also our acupuncturist in our center in Prospect.
That's beautiful.
Yeah.
That's beautiful. So what, you talked about pain. Is that the only type of patients that you see, or what are the types of patients that you end up seeing?
So particularly post-COVID, we have seen a ton of people who just have an enormous amount of stress and anxiety, more than I've ever seen in my career.
Sure.
And so again, my first prescription is always food. We cannot expect our bodies to deal with a pandemic that's been going on for 2.5 years, all the other stuff, and eat not good, not well. It doesn't mean you have to be vegan and have everything perfect, but we have to make some changes. And then movement. We know that about 20 minutes of exercise is equal to 20 milligrams of Prozac for stress and anxiety. But then we throw in some other things like breath work or meditation or guided imagery. Wherever that patient is interested, we have resources to help them learn how to do it. They can do it on their own. It's always available, and most of the time it's free. So it just kind of builds this toolbox for people to deal with their stress and their anxiety.
Well, that's beautiful to hear, because we're talking about empowering the patient to do things on their own as opposed to continually coming back to the system. But now we're building their toolbox, as you mentioned, with different techniques to figure out what's best for them.
Right.
And I love it when we talk about food, because here in Waterbury, we've got a couple of communities here that are food deserts. And that's a real challenge for our community in terms of getting access to nutritional and focused food just for their own well-being.
It is. And some of that is simpler than we make it out. There may not be a grocery store, but there are some resources that we can use to help people even in food deserts. There's this genius woman, Leanne Brown, who wrote a book about 7 years ago called Good Food on $4 a Day. It's based on the SNAP budget. And she has recipes that deal with food that you can get inexpensively in most places, not always just fresh fruits and vegetables, but on $4 a day. And those are the sort of resources that we pull into, particularly our patients who have limited resources.
Wow. Amazing, because we're hearing other things that I know the city of Waterbury and the greater Waterbury area is starting to really move forward in. So this is a perfect timing to really get these two services connected. Let's talk about post-COVID. We're in this arena right now. New Omicron booster just came out, which is really exciting.
Yes.
Here at the hospital, we've seen this sort of like the little bump we had through the summers come down, but yet we're seeing this post-COVID syndrome still sort of lingering out there. And I know we've had a couple of colleagues and a couple of even people that I know who've had to manage through this. How does what you do help with that?
Yeah. So I think of post-COVID, we know post-COVID is a multi-system disease. It affects, so far, every organ that I've been able to see, from rashes to neurologic stuff to muscle aches to joint pain to respiratory symptoms. And so when people are 8 and 12 weeks out and still not feeling better, we have to kind of step back. We have to rebuild a foundation, which includes the food and limited movement. Too much movement, we know, sets you backwards with COVID.
Sure.
And what I've tried to do is just experiment and bring in some of these other integrative approaches. About 8 years ago, we did a study with patients with multiple sclerosis in our acupuncture clinic. And what we found, we thought we would help with their muscle spasm, but we actually helped more with their fatigue. It was beautiful,
Wow.
a tiny pilot study, but
Sure.
still statistically relevant information.
Yeah.
And so what we did is we took that protocol and we moved it to our post-COVID patients. And within most people, somewhere around 65, 75%, maybe a little bit more, within 3 to 4 visits, have a notable reduction in their fatigue, which then allows them to move more and eat better and maybe get back to work and then not feel like this is for the rest of their lives. It gives the ability for them to then begin to care for themselves again.
Yeah.
So fatigue has been a huge one.
And that really goes along with the post-COVID issue, which is primarily, it's not necessarily a heart or a lung
Right.
or a leg issue.
Right.
It's just this general drain.
Yeah, and
that
what do
they've
we
had.
do in
Right.
Western medicine? We are very careful, however. So if someone has pulmonary issues that have not been properly worked up,
Sure.
we have partners in pulmonology.
Beautiful.
If people are having what sounds like cardiac symptoms to me, we have partners in cardiology. So we're really careful, but once all that is ruled out, and the majority of patients have negative tests, the majority, then we're left with what do we do? And so
Yeah.
we're pulling our integrative tools in, and they've been very helpful.
Beautiful, beautiful. And I know I've heard directly from some of our colleagues who have taken advantage of this, that the success has been resounding.
Yeah, it's been really fun to watch. It's been really exciting.
Yeah. So let's talk a little bit about the future. Let's open up our crystal ball. What's exciting in the world of integrative medicine moving forward? I know a couple of things on my mind is, for example, just us understanding more about acupuncture and sort of going through the, maybe let's call it the rigor of science
Yes.
around it, as opposed to simply, here's acupuncture and it works.
Yeah.
Well, how does it work? Why does it work? That's an interesting area for me to wrap my head around. But what do you see as, there's acupuncture, but wait till you hear about this.
So I think what I'm so excited about is community education about some of these things that are simple but transformational. We just don't have that information out there in Western medicine. And really the lifestyle piece and how people can slowly and gradually and stepwise begin to integrate these things into their lives. We want people not dependent on the healthcare system, right? We want them to be
Right.
able to keep themselves healthy. So if you have a back issue, how do we make sure you don't come back into the system 3 years later?
Right.
That's what's exciting to me. And integrative medicine has growing data that shows when we can get into those populations and help people figure out how to fill their toolbox, pull the tools out when they need them, but also bring their foundation up, make their foundation more stable so that their body doesn't default into that pain or whatever that syndrome is again.
Yeah.
So that's been really fun. And how we hope to do that is with group visits and education. And those are the next things that we'll be pulling into the center.
That's wonderful. So what about patients here in Greater Waterbury? How do we access your resources? How do they connect? What's involved in that connection?
So we have one main number for
Okay.
our regional program.
Great.
And I can give it, 860-714-8392.
We'll make sure we post that
Yes,
along the
please.
way.
And you can call that number. And what we're working really hard at is anyone who answers the phone knows about all of our services. And we often spend a lot of time on the phone with patients because it's not like, I need my physical. It's more
Right.
like, I have this, what do I do?
Sure.
And any questions that can't be answered by our team come to me. I am happy to reach out to people directly and help them navigate our system. But you can get an acupuncture appointment tomorrow if you want to. We have a big volume and big capacity for people to be able to have acupuncture and massage therapy in this region right now.
Lovely. So one of the things I like to do on our segments here is to provide a nugget for people to be able to use directly from today. So in the world of integrative medicine, what can you advise somebody, for example, who's going through a rough day? What's a good breathing exercise, for example, or a moment when they can, take a few minutes, but something that they can, an instruction to give them to help them, a little bit, one of those simple tools that they can add to their toolbox.
So one of my favorite tools is called 2 feet, 1 breath.
Okay.
And I use it actually each time before I see a patient. I stand outside the door on my 2 feet, and I take 1 conscious breath. And what I imagine is that I'm just leaving everything that I've carried through my day behind, because the person inside that door doesn't need to know that, doesn't know that I was in a bunch of traffic, or, I've got 13 other patients I need to see. It doesn't help that interaction.
Sure.
And I think it's a really important tool to kind of pull ourselves back into our own bodies. If you're going to have a conversation you don't feel like having, or you're in a really stressful situation, it is so helpful for us to come back into ourselves, to settle ourselves down with just 1 conscious breath. Nobody needs to know you're doing it. It takes 2 seconds. It doesn't take long at all. Sometimes we need a series of maybe 3 or 4 breaths if it's a big situation, but it just kind of settles it back into us, into ourselves. And when we practice that, it gets more powerful and more accessible for us, and it just works better and better the more you practice it.
So define conscious breath for
So
me.
it means only focusing on the breath. So knowing you've got 40,000 things to do, or whatever you have to do next,
Right.
thinking about the breath as it comes in through your nose, as it goes into your lungs, and it goes out through your mouth. Just that conscious awareness brings us into the moment in our own bodies and allows us to handle whatever's next just a little bit easier.
That's beautiful. So 2 feet, 1 conscious breath, focusing in on the air coming through the nose, into the lungs, and then coming back out.
Right.
Beautiful, beautiful. I want to thank you very much again for your participation today. And thank you all for joining us. Stay tuned on our next Facebook Live, where we hope to bring you again another addition to the Greater Waterbury area here at St. Mary's Hospital. Have a great day. Great.
Thanks. That's
Thank
fun.
you. Appreciate it.